Hi, my name is Alexis Quinn, and I'm a public health educator with the Onondaga County Health Department. 5 years ago, we saw an increase in food access issues throughout our community, especially for families facing barriers like cost, transportation, and limited availability to healthy options. In particular, one key gap was the lack of access to healthy, affordable foods in the city of Syracuse. Another gap was limited nutrition education. We had recognized an opportunity to partner with trusted community spaces, such as libraries, to reach people where they already spent time and felt most comfortable. This also helped reduce transportation barriers that members of our community continue to face. For example, we partnered with Mundy Branch Library and White Branch Library to improve their food pantry spaces. At first, both pantries received donations for food and other essential needs, but needed help with organization and connecting with community partners to maintain a sustainable source of healthy food. Therefore, we added shelving, storage bins, and signage. At White Branch Library, we also collaborated on developing a healthy food policy to support long-term sustainability. Even with the new space, these pantries struggled to get fresh items on their shelves. We also worked with Creating Healthy Schools and Communities to design the space to make it easier for individuals to select healthy options. For example, by putting healthier options at eye level, people are more likely to notice the healthy options and choose them without having to think about it too much. Even with the new space, these pantries struggle to get fresh items on the shelves. So we connected them with two local organizations, Syracuse Community Fridge and the Onondaga Food Resource Network, to provide fresh produce and other healthy foods to both pantries, helping create a sustainable community partnership and a more consistent supply of nutritious options. However, we noticed that the new fresh and healthy options were not being as selected as often as we expected. In many food desert communities like the city of Syracuse, this is closely tied to gaps in kitchen literacy. When limited experience in preparing fresh meals makes it difficult for pantry users to choose these options. To address this, we hosted demonstrations at both food pantry locations, showing how to prepare simple, healthy meals using food pantry staples. These hands-on sessions helped build practical skills and a familiarity in the kitchen, making fresh food feel more accessible. As a result, community members became more confident in selecting nutritious ingredients into their daily meals. These changes led to a more organized, welcoming, and consistently used food pantry space. Staff reported that the shelves needed to be restocked more often, indicating increased use within the community. Community members also shared that the redesigned spaces felt easier to navigate and more comfortable to access. Following the food demonstrations we provided, participants noted greater confidence in selecting and preparing healthier foods, with some returning to report incorporating these changes into their daily routines. Overall, these improvements strengthen the food pantry's role in reliable and a well-utilized community resource. Moving forward, we will continue to support these food pantry spaces and strengthen partnerships for a steady food supply. We also plan to bring this model to more libraries across Onondaga County so more communities can benefit. When looking back over the last 5 years, the legacy of Creating Healthy Schools and Communities is its ability to create meaningful, lasting change by meeting people where they are. By taking a big picture approach, it has helped reimagine community spaces, like libraries, not only as centers for learning, but as hubs for food access, nutrition, and overall well-being. These efforts have made it easier for individuals and families to access healthy foods, build sustainable habits, and strengthen the health of their community as a whole.